I think about heart attacks and strokes and the things that we see every day in the emergency room. We have so many years of research that tells us that we know we're doing everything we can for these patients. But with COVID, we don't know. So you're always having this guilt in the back of your head. Is there something we should have done? Is there something different? What if? And guilt is a very difficult component with death.
Hi, I'm Dometi Pongo, and welcome to The Essentials. As we remain alone together at home to flatten the curve of COVID-19, we wanted to tell the stories of the young people who can't, the doctors, nurses, and service workers who have put their lives at risk to save more. Today we'll meet Maryam Gol, an emergency room nurse based in Sacramento, whose care for herself, her colleagues, and most importantly, her patients has never been more vital. Take us to the day that you realized COVID-19 was real.
So I was the charge nurse. Ambulances call us to give us an update on when they're arriving and what kind of patient they have. Code 3 means that they're using their lights and their sirens, that they're willing to sacrifice life or limb to just save a few minutes to get to the hospital earlier. So I took the first call at change of shift, and it was a code 3 for a respiratory patient with a cough and a fever. So we had enough resources and we prepared that. 5 minutes later, I took a second code 3 call, very similar complaint. I thought that was strange. 5 minutes later, I took the third call the same way. And now suddenly we didn't have resources because all of those patients at the exact same time just pulls us too thin. We triaged appropriately and we figured it out, but that was definitely the first moment where I thought this can go very bad very quickly.
So much is changing. Every other week, more information comes out about this virus. How do you balance that?
That's a good question. Times of crisis expose some pretty incredible things, and a lot of problems get exposed. And we see it here today. I mean, personal protective equipment. If it's only coming from one place, why is that? We're America. We're the greatest country in the world. We should be able to produce things to protect our frontline staff. And I think, if anything, that process being figured out will be really important for the future.
To that end, what do you miss most about the way your workflow used to be in your past work versus what your life and job is like today?
It's been really hard. And I think one of the hardest things about it is this disease strips you of any comfort, any human interaction with everyone involved. So with the patients, they don't get visitors. They don't get their family members. They get us, and they don't know us, and they can't see us, right? Underneath all that PPE, they can't see our smiles. They can't feel our touch. The things that we do to comfort patients, we can't do anymore. As nurses and providers, we're alone in the rooms because we're trying to decrease exposure to our colleagues. So we say, let me go in, I'll do everything for an hour, to try to save them. So everyone becomes alone in the process. And so that makes it really difficult because we need people, to interact with and to feel support and comfort.
What is it like when you see a patient who has been quarantined and distanced from their family, but they're in the last hours of their lives?
So a few weeks ago, which now feels like a few months ago because of all the changes, we had a 20-ish female suddenly collapse, and we assumed it was probably because of the coronavirus. And we allowed the mom to come back. But before we did, we had to draw the glass door to keep her separated and to keep her protected. And we were trying to comfort her, knowing that her outcome was so poor and knowing that she would never touch her daughter again. There was, not a dry eye in the room. We were all just completely helpless.
How do you cope with this?
You have to figure out how to decompress and how to take care of yourself, because if you don't practice self-care, you cannot properly care for others. So piano in the back, that's a great, healthy coping mechanism. Yoga, things like that.
There are tangible things that I imagine the public can do to support the Miriams out there. What would you say?
Please be patient with medical providers. You never know what we're dealing with. People are so sensitive to us right now, and I really appreciate it. But 6 months from now, I want that same message to kind of be out there.
What makes you want to go in and fight this battle one more day?
We signed up to help. At the beginning of all of our nursing oaths and medicine, we do no harm and we're there to help. For me, it's a no-brainer. I go in there every day and I'm ready for battle. We're taking these lessons day by day, and we're here to help. So